Have you ever felt that odd pins and needles sensation in your hands or feet? Or maybe a strange burning or numb feeling that just lingers, no matter how much you shake it off? Most of us dismiss it as temporary, maybe poor circulation from sitting too long, or a pinched nerve. But here's the truth. Those little sensations might actually be your body's alarm system, warning you of deeper problems. In fact, about 20 million Americans live with some form of peripheral neuropathy, a condition where nerves outside the brain and spinal cord become damaged. And here's the scary part. In many cases, by the time people take it seriously, the damage is already irreversible. These symptoms aren't just annoyances. They are messages. And listening to them early could save you from more serious health issues linked to diabetes, vitamin deficiencies, autoimmune conditions, and even brain or spine disorders. Let's dive into the two most common causes that often go unnoticed. Stay tuned, as number one is something important, but often underestimated. 7. Chronic stress and nerve symptoms. Ever notice your hands tingle, your feet feel numb, or your face buzzes during high-stress situations? Before a big presentation, in the middle of an argument, or when anxiety spikes? This isn't your imagination. Stress can physically affect your nerves, and here's why. When stressed, your body goes into fight or flight mode. Blood flow is redirected away from the skin and extremities toward vital organs like the heart and muscles. At the same time, stress hormones such as cortisol and adrenaline surge. This combination can lead to reduced circulation, chemical imbalances, and muscle tension, all of which trigger nerve-related sensations like tingling, numbness, or burning in the hands, feet, and face. One study found that chronic psychological stress can reduce nerve conduction velocity. In other words, the electrical signals your nerves send become slower and less efficient. Unlike diabetic or injury-related neuropathy, this isn't permanent nerve damage, but it creates real symptoms that mimic more serious conditions. This can fuel a cycle where stress leads to tingling, which increases anxiety, which then worsens the symptoms. 6. Thyroid-related neuropathy. A less obvious but important cause of neuropathy is hypothyroidism, a condition where the thyroid gland doesn't produce enough thyroid hormones. Most people link thyroid dysfunction to fatigue, weight gain, or mood swings, but in reality, nerve-related symptoms may be among the earliest warning signs. Low thyroid hormones slow down the body's entire metabolism, including the repair and function of nerves. Thyroid hormones are essential for maintaining the myelin sheath and for nerve conduction velocity, the speed at which signals travel through nerves. When hormone levels drop, myelin becomes vulnerable, and nerves struggle to transmit messages efficiently. This results in numbness, tingling, burning sensations, or frequent pins and needles, especially in the hands, arms, legs, or feet. Some patients report that their limbs fall asleep more often, even without compression or awkward positioning. When thyroid levels are restored, typically through levothyroxine replacement therapy, nerve symptoms often improve within weeks to months, highlighting how strongly the thyroid is linked to nerve health. What makes thyroid-related nerve damage especially concerning is how silent and gradual its progression can be. Unlike injuries or sudden illnesses, neuropathy caused by thyroid dysfunction often creeps in slowly, with subtle signs that people tend to brush off. A little tingling in the hands, occasional numbness in the feet, or unexplained fatigue might be blamed on stress, aging, or even poor circulation. In fact, estimates suggest that nearly 60% of people with thyroid disease are unaware they even have it. This happens because the symptoms overlap with everyday complaints. Things like low energy, weight changes, mood swings, or brain fog that many people attribute to lifestyle rather than a medical condition. Women over the age of 40 are particularly vulnerable, especially due to hormonal fluctuations during perimenopause and menopause. Autoimmune thyroid conditions, such as Hashimoto's thyroiditis, are also a major culprit. In Hashimoto's, the immune system mistakenly attacks the thyroid gland, leading to chronic inflammation and gradual destruction of thyroid tissue. Over time, this reduces thyroid hormone production, which directly impacts nerve repair and function. Thyroid hormones, T3 and T4, are essential for maintaining nerve conduction velocity and the integrity of the myelin sheath, the protective coating around nerves. When hormone levels fall, the nerves lose their protective insulation and signals start slowing down or misfiring. This is why patients often report tingling, burning, or numbness in their extremities, along with poor coordination or muscle weakness. Thankfully, testing is relatively straightforward. Doctors usually order blood tests to measure TSH, thyroid-stimulating hormone, along with free T4 and T3. In autoimmune cases, antibody tests, such as anti-DPO or antithyroglobulin antibodies, may also be done to confirm Hashimoto's or other autoimmune thyroid conditions. The gold standard is thyroid hormone replacement, most commonly levothyroxine, which restores hormone balance and gradually improves nerve health. However, lifestyle and nutrition also play a major role in supporting thyroid function. Iodine, essential for producing thyroid hormones. Natural sources include seaweed, kelp, nori. Selenium, protects the thyroid from oxidative stress and helps convert T4 to active T3. Brazil nuts are one of the richest sources. Zinc, important for thyroid hormone synthesis and immune regulation. Found in pumpkin seeds, oysters, and legumes. A balanced intake of these nutrients doesn't replace medication when needed, but it provides a strong foundation for long-term thyroid health. 5. Chemotherapy-induced neuropathy, CIPN. Another major but often overlooked cause of neuropathy is chemotherapy. Around 30 to 40% of patients undergoing certain cancer treatments develop tingling, burning, or numbness in their hands and feet. Unfortunately, in some cases, these symptoms don't fully resolve even after treatment ends, leaving long-lasting effects on mobility, grip strength, and quality of life. The biggest culprits are drugs like paclitaxel, cisplatin, and vincristine. While effective at killing cancer cells, they also harm healthy peripheral nerves, mainly by damaging the mitochondria, the tiny power plants inside cells that generate energy. Without enough energy, nerve cells cannot repair themselves or maintain the integrity of their axons and myelin, leading to progressive dysfunction. Symptoms often worsen with each cycle of chemotherapy due to cumulative toxicity. Patients typically describe sensations like pins and needles, buzzing, or electrical shocks in their extremities. Omega-3 fatty acids, EPA and DHA, 400 mg/day shown in trials to reduce nerve damage severity during chemotherapy, likely due to their anti-inflammatory and membrane-stabilizing effects. Glutamine supplementation supports energy metabolism in nerve cells. Cryotherapy, cold gloves or socks during infusion reduces drug delivery to peripheral nerves by constricting blood vessels, lowering exposure. These approaches don't eliminate CIPN entirely, but can significantly reduce its severity. Importantly, patients must consult their oncologist before adding supplements, since timing and interactions with treatment matter. 4. Chronic alcohol use. Most people associate alcohol with liver disease, but chronic alcohol use is a hidden cause of nerve damage, alcoholic neuropathy. Over time, alcohol is toxic to nerve tissue, causing numbness, tingling, or burning in the hands and feet. It also depletes nutrients like B vitamins, especially thiamine B1, which are critical for nerve repair. Alcoholic neuropathy is a serious, progressive condition that affects a surprising number of long-term drinkers. It doesn't usually strike overnight. Instead, it develops silently and gradually, damaging both the central nervous system, the brain and spinal cord, and the peripheral nervous system, the nerves that extend to the arms, legs, hands, and feet. One of the earliest warning signs is often a burning, tingling, or numb sensation in the feet, which can later creep upward into the legs, hands, and arms. As it progresses, people may also notice muscle weakness, cramps, difficulty walking, or even loss of coordination. What's happening here is that alcohol is essentially acting like a neurotoxin, slowly poisoning the nerves and depriving them of the nutrients they need to function. Chronic alcohol use disrupts the absorption and metabolism of key nutrients, especially vitamin B1 thiamine, B6 pyridoxine, B12 cobalamin, and folate. These nutrients are critical for the health of the myelin sheath, the protective covering that insulates nerve fibers and allows fast, efficient communication between nerve cells. Without this protection, nerves begin to misfire or lose their ability to transmit signals, leading to the classic symptoms of neuropathy. On top of this, alcohol increases oxidative stress, the buildup of free radicals that damage cells, and neuroinflammation in nerve tissue. Together, these mechanisms accelerate nerve degeneration. Research shows that 25% to 66% of long-term heavy drinkers develop some degree of neuropathy, depending on drinking patterns, duration, and genetic susceptibility. The condition is often misdiagnosed or overlooked because many people assume their symptoms are just part of normal aging or poor circulation. Recovery path. Complete alcohol cessation is the first and most crucial step. No treatment will work otherwise. Nutrient restoration with high-dose B-complex vitamins is essential. A special fat-soluble form of B1 called benfotiamine, 300 to 600 mg/day, penetrates nerve cells more effectively than standard thiamine. Methylcobalamin, B12, another bioavailable form, supports nerve regeneration and communication. Antioxidants like alpha-lipoic acid have also been shown to reduce nerve pain and support mitochondrial function in damaged nerve cells. 3. Autoimmune-related nerve problems. Another hidden cause of tingling and numbness is autoimmune disease. Here, the immune system mistakenly attacks nerve tissue. Conditions like multiple sclerosis, MS, lupus, or Guillain-Barré syndrome can damage the protective coating of nerves, called the myelin sheath. When myelin is stripped away, nerve signals slow down or get lost entirely. In MS, this process leads to episodes of numbness, weakness, or persistent tingling. MS affects about 2.8 million people worldwide, and women are almost 3 times more likely than men to develop it. Risk factors include low vitamin D, gut microbiome imbalances, and past viral infections like Epstein-Barr virus, EBV. While there's no cure, research shows that reducing inflammation can slow progression and ease symptoms. Omega-3 fatty acids, fish oil 1,000 to 2,000 milligrams daily to reduce autoimmune-driven inflammation. Vitamin D3, 2,000 to 5,000 IU daily, especially in low sunlight populations. Probiotics help restore gut balance, which in turn modulates immune activity. 2. Vitamin B12 deficiency, the silent saboteur. Vitamin B12 deficiency is one of the most overlooked causes of tingling, burning, and numbness. Unlike sudden illnesses, this problem creeps in slowly and can masquerade as something else entirely. Common misdiagnosis? Stress, depression, or even dementia. In reality, the nerves are starving. Here's why B12 matters. B12 maintains the myelin sheath, the protective insulation around nerves. Without it, nerve signals misfire, leading to tingling, zapping sensations, or numbness. Over time, permanent nerve damage can set in. Studies show up to 20% of older adults have low or borderline B12 levels. Risk is higher in vegans/vegetarians, since B12 is found mainly in meat, fish, eggs, and dairy. Seniors, because stomach acid, needed to absorb B12, naturally declines with age. People on common medications like metformin for diabetes or proton pump inhibitors for acid reflux. The solution is often simple and safe. Methylcobalamin, active B12, is the best form. 1,000 micrograms daily, taken orally, sublingually, under the tongue, or via injections if levels are very low. For best results, pair with folate and B6. This trio regulates homocysteine, a compound that can harm nerves and blood vessels when too high. Imagine your nerves as electrical cables. B12 is the rubber coating that prevents sparks and shorts. Without it, the system fails. When it comes to tingling, burning, or numbness in one limb, or even in just a part of your body, one of the most overlooked culprits is pinched nerves. This isn't always about a major injury or a sudden back problem. In fact, many cases are linked to everyday habits. Sitting too long without breaks, slouching over laptops or phones, or lifting heavy objects with poor form. These subtle, repetitive stresses can gradually cause nerve compression. Nerves exit the spinal cord through tiny openings between vertebrae. If these spaces narrow due to herniated discs, spinal stenosis, narrowing of the spinal canal, or even tight, imbalanced muscles, the nerve roots can get compressed. Think of it like stepping on a garden hose. Water flow gets blocked. In the same way, compressed nerves disrupt the electrical signals that travel between the brain and the body. That's why people often experience tingling and numbness, like your limb falling asleep, burning or stabbing pain along the nerve pathway, weakness in the affected muscles. A common example is sciatica, where a herniated disc in the lower back presses against the sciatic nerve, sending pain shooting down the leg. Over time, this isn't just an annoyance. It can impact balance, coordination, sleep, and mobility. Here's the surprising part. You don't always need a major trauma. Even micro-misalignments from poor posture or a sedentary lifestyle can set off a chain reaction. Over years, this can cause chronic inflammation around the nerve, keeping symptoms alive even if the compression isn't severe. Doctors usually confirm nerve compression with physical exams, MRIs, or nerve conduction studies. But treatment doesn't always mean surgery. Posture correction and ergonomic changes, better desk setups, lumbar support, standing breaks can relieve pressure. Stretching and core strengthening exercises stabilize the spine and reduce recurrence. Physical therapy helps restore alignment, improve flexibility, and retrain body mechanics. Since inflammation plays a central role, nutritional support can be powerful. Curcumin, turmeric's active compound in clinical studies, 500 milligrams of curcumin phytosome daily reduced nerve pain and improved function. Magnesium, glycinate or citrate around 200 to 400 milligrams per day helps relax muscles and prevent spasms that worsen compression. 1. Diabetic neuropathy, nerves under attack. Diabetes isn't just about blood sugar. It's about nerve health. Over time, high blood sugar acts like acid slowly corroding delicate wires. Those wires are your nerves. Here's how it happens. Chronically high sugar causes glucose toxicity, which leads to oxidative stress and inflammation. The tiny blood vessels that feed your nerves become damaged, like a clogged garden hose. Without enough nourishment, nerve signals get distorted or blocked. The result? Strange tingling, stabbing pains, or even total loss of sensation, especially in the feet. Around 60 to 70% of people with diabetes will develop some form of neuropathy. And it's not limited to full-blown diabetes. Even people with prediabetes, slightly elevated sugar, have been found to show early signs of nerve damage. The good news, you can take back control. Lifestyle shifts matter. Daily movement, lowering sugar and refined carbs, and adding anti-inflammatory foods like leafy greens, berries, and omega-3 rich fish. Supplements help too. Alpha-lipoic acid, ALA, 600 milligrams per day, reduces oxidative stress and improves nerve function. Benfotiamine, fat-soluble vitamin B1, has been shown in European studies to protect and repair nerves. Think of it as giving your nervous system fresh wiring and cleaner fuel. The good news is that stress-related nerve symptoms are often reversible with simple strategies. Relaxation practices, deep breathing, mindfulness meditation, and progressive muscle relaxation can calm the nervous system, restore circulation, and ease nerve tension. Magnesium supplementation, 200 to 400 mg/day magnesium, is a natural nerve relaxant that reduces anxiety, helps muscles release tension, and improves sleep quality. Many people are deficient, so restoring levels can make a noticeable difference. Lifestyle foundations. Quality sleep restores hormone balance and nerve repair. Daily movement improves circulation and nerve resilience. Hydration keeps electrolytes balanced, which is vital for nerve signaling. Finally, if you notice tingling, numbness, or burning sensations regularly, don't ignore it. Track when it happens, what triggers it, stress, diet, lack of sleep, and how long it lasts. This information can help both you and your doctor spot patterns. If symptoms are new or worsening, a simple blood test or exam could provide answers. And in many cases, early intervention prevents long-term damage. Thyroid disease, chronic stress, and lifestyle deficiencies can all affect nerve health. The signs, tingling, numbness, burning, are your body's way of waving a red flag. By tuning in, supporting thyroid balance, managing stress, and nourishing your body with the right nutrients, you can protect your nerves and improve your long-term well-being. If this video opened your eyes to how thyroid issues and stress can silently affect your nerves, don't keep it to yourself. Share it with a friend or loved one who may be struggling with unexplained tingling, numbness, or fatigue. I'd love to hear from you. Have you ever experienced nerve symptoms linked to stress, thyroid imbalance, or nutrient deficiencies? What has helped you feel better? Share your story in the comments. It could inspire and guide someone else on their healing journey. And if you found this helpful, hit the like button, subscribe to Healthy Life for more science-backed insights, and turn on notifications so you never miss a new video. Remember, sometimes small daily choices like managing stress, eating the right nutrients, and paying attention to your body can make a big difference for your nerve health. Thank you for watching, and I'll see you in the next video.